Diabetes insipidus, D, is a rare condition that affects the body's ability to regulate fluid balance. Unlike diabetes mellitus, which affects the body's ability to regulate blood sugar levels, D affects the body's ability to regulate the amount of water in the bloodstream. This can lead to excessive thirst and the production of large amounts of urine, which can cause dehydration and other health problems. There are four main types of D: central, nephrogenic, dipsogenic, and gestational. The most common type is central D, which is caused by a problem with the hypothalamus or pituitary gland. These glands play a key role in regulating fluid balance by producing a hormone called antidiuretic hormone, ADH, also known as vasopressin. In central D, the hypothalamus or pituitary gland is unable to produce enough ADH, or the body is unable to respond to the hormone properly, which can result in the production of large amounts of urine and dehydration. Nephrogenic D is caused by a problem with the kidney's ability to respond to ADH. This type of D can be hereditary or acquired, and can be caused by a variety of factors, including certain medications, kidney disease, and high levels of calcium or magnesium in the blood. Dipsogenic D is caused by excessive thirst, which can be due to a variety of factors, including certain medications, brain tumors, and damage to the hypothalamus or pituitary gland. This type of D is relatively rare, and can be difficult to diagnose because it is often mistaken for other conditions, such as diabetes mellitus. Gestational D is a temporary form of D that occurs during pregnancy. It is caused by increased levels of hormones in the body, which can affect the body's ability to regulate fluid balance. This type of D usually resolves on its own after pregnancy, but it is important to monitor and treat it during pregnancy to avoid complications. The symptoms of D can vary depending on the type and severity of the condition. Common symptoms include excessive thirst, frequent urination, and the production of large amounts of dilute urine. In severe cases, dehydration, weight loss, and low blood pressure can also occur. Diagnosis of D typically involves a series of tests, including a medical history, physical exam, and laboratory tests. A water deprivation test is often used to confirm the diagnosis, and to distinguish between central and nephrogenic D. In this test, the patient is asked to stop drinking fluids for a period of time, and their urine production and blood electrolyte levels are monitored. Treatment of D depends on the type and severity of the condition, and may involve a combination of lifestyle changes, medications, and medical procedures. For central D, treatment may involve hormone replacement therapy, using a medication that replaces the missing ADH. For nephrogenic D, treatment may involve changing medications that may be contributing to the condition, and controlling any underlying medical conditions that may be causing the problem. In some cases, surgical procedures may be necessary to treat D. For example, in central D, a procedure called a pituitary gland tumor removal may be necessary if a tumor is causing the problem. In nephrogenic D, a procedure called a kidney transplant may be necessary if the kidneys are unable to function properly. In conclusion, diabetes insipidus is a rare condition that affects the body's ability to regulate fluid balance. It is caused by a variety of factors, including problems with the hypothalamus or pituitary gland, and can result in excessive thirst, frequent urination, and dehydration. With proper diagnosis and treatment, many people with D are able